Hi there. Welcome to the While You Wait podcast, where it's all about helping women just like you learn about the bladder while you're waiting for your appointment with that specialist. Each week, I'll combine science, medicine, and common sense so you can learn, become empowered, and get started on your journey to dryness. I'm your host, Dr. Sarah Boyles, a board-certified urogynecologist. Let's get started. Hi there. I'm here today with Amy Anderson, who works for the Axonics company. And Axonics has a sacral nerve stimulator that is approved for the treatment of overactive bladder, fecal incontinence, and retention. We use it the most for overactive bladder, although it works really well for the other conditions as well. And just a quick overview on overactive bladder. So overactive bladder, which is also called urgency urinary incontinence, is when you're going to the bathroom frequently, right? So more frequently than you want to be going, and it's not correlated with your intake of fluids. You're going urgently, right? You're worried about not getting there on time, and then maybe leaking before you can actually get there. And when we talk about treatment for overactive bladder, we always start with education and behavioral training and pelvic floor exercises. Then we move on to maybe medications or supplements. That's second line therapy. And then we get to third line therapy. Not everyone needs third line therapy, but many women do. And that's where the sacral nerve stimulators live, right? So once you've kind of tried some other things and they haven't worked, they're definitely not first line therapy. So Amy, thank you so much for being here. And, the first thing that I wanted to talk to you about is just how does the sacral nerve stimulator work for helping the bladder? I think that's something that's super confusing for patients. We don't usually think about the back nerves impacting the bladder. So can you just give us a super basic overview?
Yes, and thank you so much for having me. I love giving information about this product because we call it the secret therapy, but we're trying to make it not a secret. So thank you for letting me share. So with overactive bladder, the bladder is sending messages to the brain that the bladder is full, even when it's not. And so there's abnormal communication between the bladder and the brain. And by stimulating the sacral nerve roots responsible for bladder and bowel control, we're able to correct the communication between the bladder and the bowel so that the patient gets more appropriate signals. And this might mean where previously they were getting the sense that they needed to use the bathroom and having not enough time to make it, versus now getting the signal with an appropriate amount of time so that they can make it to the bathroom.
And so when we stimulate those nerves, how much better, what kind of improvement can you expect, or do we normally see?
Certainly. So we've done some significant clinical studies, and from those studies, we see 93% of patients respond to this therapy. And what we consider as a response is a 50% decrease of symptoms. But not to be discouraging, we really see about 82% of patients have a 75% improvement or better. And oftentimes patients will be completely dry. I like to share it's not a cure, it's a therapy. And so it's about improvement. And as much as I would love to tell patients that it will fix everything and they're going to be normal, doesn't quite work that way.
Yeah. And I think, those numbers are always super confusing, right? When you're talking about, 80% of people are 50% dry, it's hard to kind of recognize, what that really means in terms of symptom relief. There are some people who are totally dry. For a lot of people, it all just becomes that much more manageable. And, sometimes we do use medications as well. But I think it frequently turns this problem from being something that is just so very difficult to manage to something that's reasonable. The thing that I find with overactive bladder, I mean, nobody likes to leak, but I think overactive bladder is worse than stress incontinence because it's a little bit less predictable, and frequently the volume that you leak is just so much more. And so it becomes more difficult to be discreet. So, when we talk about sacral nerve stimulation, I mean, we're actually putting this little wire, a little lead down in the back by your sacral nerves. And then if it works, we implant a battery. And unlike a lot of the things that we do, there's a trial period where you live with the stimulator and without a battery implanted for a week or two to see if your symptoms are better. And I think that's something that's just so unique about this therapy because you get to see how it feels and how it works for you before you make a decision. And so, one thing I didn't say when we were started is that we work pretty closely together because anytime I do a stimulator, you're there kind of coaching the patient, educating the patient, helping program the patient, right? Because there are a lot of different ways that we can set up the stimulator. And so, you're a very important part of the treatment protocol. So, when we do that trial period, we always have patients do avoiding diarrhea ahead of time where you document your symptoms in terms of frequency or leaks. And then you have to repeat that during the trial period, right? So we can compare, make sure you're at least 50% better. Can you talk about your interactions with the patient during that time frame? I mean, I see them ahead of time. I go over everything with them. I implant it. I talk to them on the day of surgery. But then, what's your role and how do you support them?
Sure. So every patient that does an Axonics trial gets an Axonics coach. And so in Oregon, that's myself or one of two clinical specialists that work with me on my team. And that Axonics coach is that patient's point of contact, not only through their trial, but if they go to implant, remains their point of contact for the life of their device. And the Axonics coach will reach out to the patients prior to their trial procedure. And that's to introduce themselves, answer any questions, kind of go over what to expect during their trial. And so we'll do that, get them input into our patient care management system. That's basically an electronic record system so that we can know what's happening with that patient and how their device is working. And it enables anyone on the team to be able to help the patient if need be. So we get their baseline symptoms just from their first bladder diary that they did for you. And then we'll share with them what the week will look like. And there are some mild restrictions that they have to adhere to, like bending at the waist, twisting, and lifting overhead. And so we kind of go through that, talk about that. And then the day of the procedure, I or one of my team will meet with the patient in the pre-op area and introduce ourselves face to face, show them how to use the remote control, which is super simple, but it's nice to see in person because that's how they'll interact with the device during their trial. And then we'll go over those post-operative instructions as well, those kind of restrictions, and talk about that bladder diary and the importance of it. During the procedure, like you shared, I'll be in the room and providing that stimulation to the nerves as you are testing those nerves.
I think one of the hardest things about that week, right, is that when you're going through that trial period, you can't shower, right? You can sponge bathe, but you can't shower. And so, I'm always surprised when we do trials in the summer. I always feel like it should be kind of a winter, avoid the heat kind of activity, but lots of patients are okay with that. We talk about that at length. If during that week they have a problem with their stimulator, I mean, let's say I just had my trial, I'm in the middle of my trial, it's midnight, and I have this, weird sensation that I really don't like. Can I call you?
So you can absolutely call at midnight. I will probably not answer because I will be sleeping, but I will call you in the morning. We make sure that the patient has the ability to turn the device off if for any reason they're experiencing discomfort. That's one thing that we make sure they know how to do, because we don't want anyone to ever have any pain or discomfort. That should never happen with the device. And so they know how to turn it off, and then we can deal with things in the morning.
I think you're right. And that's when they usually call me, right? If there's an issue like that. And one of us always has our pager on. But the point that I was trying to make is that you're very available during that time frame, right? I mean, you frequently contact patients on weekends or at a time that is convenient for them. And I think you do a really good job of, talking to the patient and kind of figuring out how many touch points they want, right? Because some people want a lot of touch points and some people, really don't unless there's something, that they need help with.
Right. And during the trial, if it's just a week-long trial, it's more likely that we'll probably touch base with them on a daily basis because we have a shortened time period. So we want to make sure they're getting the best results possible. And we might make small adjustments to the stimulation during that time frame. But if they're doing really well, then maybe we'll talk every other day. Conversations are really kind of going through the bladder diary and getting a sense of how their symptoms are now compared to before the trial.
So, can you talk a little bit about what you can change during that period, right? Because, when you're all changing this, I mean, sometimes we have patients come into the office if we need to do something more extensive, but there's quite a bit that you can do remotely, right? So, I mean, we have this wire that's in place, and then what can you do to change the settings remotely?
So, from the patient's remote control, they go home from the trial with two different programs. And so we have two programs we can utilize during the trial. And within each program, we have multiple levels of stimulation. And I like to say that with nerve stimulation, more is not better. Yeah. Which is very hard because we all think if we can tolerate more that everything will be better. But with nerves, they don't want to be overstimulated. We're looking for kind of that sweet spot. And that's one of the reasons that we communicate throughout the trial, because we're trying to find where they get the best efficacy from the product.
It's funny, human nature, right? I mean, we all keep wanting to turn it up and turn it up. And sometimes that, definitely makes it work a little bit more poorly. And then if things aren't working, we can have them come into the office and then we can kind of reset some of the programs, correct?
Yes, yes. And it's rare, but occasionally the external battery that the patient wears during the trial will get turned off. Yeah. And so occasionally we may need to have them come back into the clinic, and it's very simple. We can make that adjustment in the clinic.
It's funny because it is a little bit of a techie procedure. And I feel like the majority of people aren't really comfortable with that, right? They want to turn it off, turn it on, turn it up, turn it down, but really, aren't interested in kind of the physics of all of that, right? And so we try to make it as easy as possible. And I think that's one of the really nice things about Axonics is, the remote's very easy. You've definitely made it all, pretty user friendly, so that techie part is not as intimidating as, previous iterations of this technology were. When you are reprogramming it, what does that look like for a patient? Right. Because I think, are you plugging them in? Like, what is that? Do they have to get undressed? Right. I mean, I think that all sounds super foreign to most people.
Right. And they're so used to coming to your clinic and having to get undressed.
I know. Nobody likes that, though.
It's very nice. They don't have to get undressed. And whether it's the trial battery that's external or they have the permanent implant that's internally implanted, they come to the clinic and we have a programmer. It's nice and bright green Axonics colors. Yeah. And I can scan the patient's device just by sitting 2 feet from them. And when I say scan, it will connect with the battery and it will read that device. That device captures a great deal of information. It captures all the programs that they've used previously and the amount of time that they've spent on each program, which is helpful because sometimes a patient will come in and say, well, it really worked best in October. And so that gives us a little bit more data to go back and see. But a unique element to the Axonics device is that we have an algorithm, which is a fancy word for data analytics that we analyze all of the patients with this device, and we see that if they have certain motor thresholds, which is where they get response, that we want to utilize their lowest motor threshold, and our device actually tells us what are going to be their best programs. So we're not spending a ton of time trying every program imaginable. We know based on what your test results were in the operating room where that patient is going to see the best results from a certain program. So when they come in, I scan the device, I see what programs they've used, and we'll go to the next best programs. And occasionally a patient's nerves will kind of accommodate to a program. And so sometimes we do need to switch programs and try a different program.
Yeah.
And we can have them try 2 without coming into the clinic. But once we've exhausted those 2, then they do need to come into the clinic.
Yeah. And usually those are, pretty easy, casual visits, right? Where we're sitting around a table and we're talking and, reprogramming the device. So that is something that we didn't talk about at the beginning. So the nerve that we're stimulating is the third sacral nerve, right? Which has both sensory and motor function. And there are different sensory reflexes, different motor reflexes that you get when you stimulate that nerve. And so, a lot of times women will feel it in the perineum. Sometimes they feel it more, kind of rectally. So we're asking them, kind of where they feel that sensation. And then in the operating room, we're looking at motor reflexes, which are related to the pelvic floor contracting and also to, your toe moving, actually. So, if all of that goes well, from an insurance perspective, we can implant the battery and make it a permanent device if a patient is 50% better. And we define that based on the voiding diaries, right? So you're leaking 50% less than you were before, or maybe you're going to the bathroom 50% less, or even getting up at night 50% less, right? The definition is always different depending on the patient. I talk to my patients a lot about how just because insurance says that we can implant it doesn't mean that we have to implant it, right? And 50% better is better enough for some people, but not everybody, right? And I've definitely had patients who've had, huge numbers of leaks, like 20 leaks a day. They're going down to 10 leaks a day. And is that good enough? And for some patients it is, because the volume of leaking is so much less that it feels so much easier. Some people will say, no, this isn't worth a permanent implant for me. So, we kind of gauge all of those things. Once it comes time, let's say it works and we're going to implant it, there are different types of batteries that we can use. So do you want to talk a little bit about the different batteries that are out there and the choices that women have for this? Well, I guess I should say patients, because this device can be used for men as well.
Correct. Yes. So we offer 2 types of batteries. One is a rechargeable battery. And that battery needs to be charged about twice a year. And the charging takes 1 hour. And we're able to set up reminder emails. If that's helpful to patients, we can do that. And that battery has a 20-year lifespan. So I was just speaking with a patient today, and she goes, well, I won't be around then. So that's plenty of time. 20 years is a really great improvement in this.
Well, and that battery has been around for how long, right?
That's 26 years.
No, but the one
Oh,
that you're talking about,
the rechargeable, just
yeah.
since 2019.
Yeah. I mean, that's pretty new. And the amount that you're having to charge it is much less than it was when it first came out. I mean, it's
Yeah.
amazing how quickly that technology is advancing.
Yes. Our goal is to ensure that no patient is left behind. We really want this therapy to be accessible for all patients. And, part of that is that there are patients that charging is no problem, and others it is too much on their plate. And so we also have a non rechargeable battery. And that battery offers patients approximately 15 to 20 years.
Yeah.
It's more dependent upon the amount of stimulation that they need
Yeah.
for their symptom improvement.
And then, when the battery dies, we can always replace the battery. But, what ends up happening is that's a surgery. So, I have to reopen up that incision. I have to remove the battery, unhook the battery from the lead, and then put a new battery in. And it's not a particularly complicated surgery. It's not a hard surgery, but it is a procedure that you have to go through that requires, some degree of anesthesia and healing. So, depending on what else is going on in your life, right? That battery change can be a little bit of a pain. And usually we wait until the battery dies, right? So whatever benefit you're getting, it, has gone away. And, my patients that love this technology, they just hate that period because there's no way we can get that battery change done quickly enough, right? I mean, they just want it to be done yesterday. So even if we can get it done in a couple of weeks, it never feels like it is soon enough. How often do you think patients need to be reprogrammed? So, once this works for you, how often do you see that accommodation?
It really varies patient to patient. So some patients can be implanted and they can go a year, maybe 2 years before they need to try a different program. And others might need to come in 6 months.
Yeah.
And like I said, sometimes we're just trying to find that sweet spot where it's just the right amount of stimulation for the nerves to respond the way that we would like them to.
Yeah. And I feel like everybody needs to be reprogrammed at some point, right? And that should be an anticipation that at some point in time, you're going to have to come into the clinic, maybe in 6 months, maybe in 12 months. But you should assume you're going to have to come in at least once a year just to make sure that things are optimized and still, working for you. I mean, I think the, kind of the holy grail is to have things just work and never have to think about it. But this does require, a small amount of maintenance over time.
Yes. And something that our company has put into place is, in addition to the patient's Axonics coach, we have therapy support specialists who are checking in with patients about every 45 days during that first year, because we really want to make sure that patients are getting the efficacy and that they don't get left behind. And so in those calls, we might discover that the patient could utilize some optimization.
Yeah.
And so that might trigger for us to schedule a programming appointment.
Yeah. And I think that's really important, right? I mean, this technology is not something that patients can troubleshoot on their own. They do need, support. And that's why, we can't really do these cases without the support that the company provides, right? There isn't the in-house resources in the office, right? So it really is a team approach. Okay. So what are the things, so I like this technology, but what are the things that you hear from patients? Like, what do patients not like about it?
Well, patients don't like it when they start to have symptom return. So
Yeah.
I always say it's really important to reach out when you first start to notice a change, because if we can address it sooner, then they're not going to go down that path of feeling.
I know, but I think it's so hard to recognize it, right? Because I think we always blame ourselves, right? We think, oh, well, I had a little bit too much fluid and, oh, maybe I was constipated and I was doing this thing and I was on vacation, right? I mean, it's hard to be objective about it. I mean, I think that's where Bladder Diaries, help you be very, very objective about everything. But, I think sometimes we kind of gaslight ourselves when we're having symptoms and, blaming it on perhaps a bad habit one might have.
Right. And that's where those therapy support specialists doing
Yeah.
those check-ins a few times a year really, I think, is helpful because they're going to ask those questions and
Yeah.
they're going to do it in a way that the patient can reflect and be like, oh, yeah, I am kind of creeping back up on my nighttime voids.
Yeah. Well, and I mean, it's hard to be objective, right? I mean, I can't treat my family. I can't treat my kids. I don't diagnose their symptoms correctly, right? I always outsource that. And I think that's the same about ourselves a lot of the time too. How often do you think people get weird sensations from the technology that they don't like?
It's fairly rare,
Yeah.
but patients will sometimes in certain positions that causes the nerve to get a little closer to those electrodes.
Yeah.
They might find that in certain positions, the stimulation feels stronger. And they usually will describe it as a whoop.
Yeah.
And
I've seen that a couple of times, but I think it's pretty rare.
one thing that's also really important to know is that this device has had no serious adverse events. So the kinds of things that are potential are really more related to surgery, like the risk of infection. So
I'm going to ask you questions that my patients ask me. So can I be paralyzed if you put this in the back of my spine?
no, we are not anywhere near your spinal cord.
Can I have a huge bleed with this type of procedure?
Huge, no, unless you have a bleeding disorder.
Yeah.
Then that would
I
be
mean,
something else.
it feels like bad karma to say, no, that could never happen, right? Because clearly if you're on blood thinners or if you have a bleeding disorder, something can happen.
Yes.
And then what about the risk of infection?
So the risk of infection is there, as with any surgery where there's an incision or an opening outside of your body. And so we provide you all of the direction and information so that you can make this as safe a procedure as possible.
Yeah.
And then obviously all of the facilities that we perform these procedures in have infection risk is a number one concern. And so they take extra precautionary.
Yeah, I mean, we're very careful about it, right? I mean, we clean the body with, very specific soaps. We, have antibiotic protocols, all of those things. But infections can happen, right? And sometimes it does have to be taken out because of that infection risk, right? If a foreign body is infected, it has to come out of the body. And so that can happen, but it is rare. Can you talk about MRI use with having this placed? Because that used to be a contraindication, but that is no longer the case.
Correct. So we have very broad MRI guidelines, and it really comes down to the type of machine that a facility has. But our guidelines are so broad that they cover most machines that are in facilities today. So a patient can have a full body MRI, they can have an extremity MRI, a head and neck MRI, and it is for both the battery and the lead. So all components.
Yeah, which is, very reassuring, especially for people who get, regular MRIs and have failed other therapies.
Yes.
And then if I have this device and I am flying somewhere, what do I have to do?
So the device is safe to go through any of the detection systems at the airport. Of course, your battery will be displayed on those devices. So it's important to share with TSA that they have an implant, and we provide an implant card with the serial number of their device and your information as the physician who implanted it.
Mhm.
And they show that to TSA, and TSA will typically hand wand those patients.
Yeah. I think that's, just an important thing for people to know because, flying's not always easy and you
Right.
need to have your plan in place. And, I have had a couple of patients where it's just taken them a little bit longer to get through the security line because they did need to be wanded, right? And getting the extra personnel available took a little bit of time. So, and I think everyone's grumpy in the airport, right? So just preparing yourself for that. So, I mean, I think this is great technology, just like you said. I think that it is one more option. So many women benefit from it. There are people who don't like this idea. It just doesn't suit them for whatever reason. And that's fine. That's why we have lots of different treatment options. Are there any final words that you want to say or thoughts you want to share?
Well, this is a long-term therapy for a chronic condition. So it's nice because it will provide much longer efficacy than a lot of options. And so that's one reason that patients do choose it. One other piece is patients will always ask, well, what does it feel like?
Yeah.
And so I like to describe it as kind of feeling like a pulse sensation. And they will feel that pulse sensation in the bicycle seat area. So they may feel it vaginally, they may feel it in the perineum, or even in the lower buttocks.
Yeah.
And it's never uncomfortable and should never be painful. Most patients have to really concentrate on it to even know that it's happening.
Yeah. I think that's an important point, right? Where at the beginning you do notice it and then you get to a point where you're not really feeling it at all. And I think for most people, it's not stimulating. It's not painful. It's different, right? It's a different
Right.
sensation than you've ever felt.
Yes, yes. But I encourage everyone to research their options because living in Depends and pads does
Yeah.
not have to be a way of life.
No, there's so many other options out there. So, and the company's website, just in case anyone wants to look anything up, can you just remind me?
Yes, it's www.axonics.com, and that's AXONICS.
Okay. Thank you so much. I really appreciate your time, especially late in the day, because it's been a long day for both of us. Thanks for listening. If you want more information about me or my online work, check out my website at www.thewomensbladderdoctor.com.